Colonoscopy and colon health. 7 essential facts. Colon cancer is the second most common cause of cancer-related deaths in the United States, according to the Centers for Disease Control and Prevention, CDC. For the purpose of preventing this sort of cancer, testing is crucial. Over 50,000 people are predicted to pass away from colon cancer in 2017, according to stats gathered by the National Cancer Institute Surveillance, Epidemiology, and End Results SEER program. You should see a doctor right away to be checked out if you experience any disease-related symptoms. Keep watching to learn more about colonoscopies, colon cancer, and what to tell your doctor before one by continuing to the video. Don't forget to activate notifications so you won't miss any of our new videos before we start this video if you want to see more everyday advice like this. Before we get started on what you should ask your doctor before having a colonoscopy, let's first talk about the different types of screening options there are for colon cancer. Colon cancer screening. There are numerous screening and preventative methods available to check for colon cancer. The U.S. Preventive Task Force advises waiting until after the age of 50 to start regular screening for those who are not at high risk for the disease, even though a colonoscopy is the most complete check to undertake. More than 30% of colonoscopies performed in Texas through Medicare claims may not have followed screening guidelines, according to research by Christine Sheffield, an assistant professor of surgery at the University of Texas. Fecal occult blood tests and flexible sigmoidoscopy are two additional screening techniques for the prevention of colon cancer. According to the University of Texas, doing a colonoscopy on patients who wouldn't be a good candidate based on screening standards could expose them to the dangers of the procedure without any proof that it will be beneficial. Keep watching until the very end for some advice on how to effectively remove waste from your colon if you're wondering how to cleanse your colon. Side effects. The Canadian Cancer Society lists minor quantities of blood in the stool for 1 to 2 days as one of the possible side effects of colonoscopy. Nausea, vomiting, bloating, or discomfort of the rectum as a result of the colon being cleaned out and inflated with air. If a biopsy was performed and/or a polyp was removed. If a colonoscopy is not immediately advised by your doctor, they might suggest a sigmoidoscopy instead. In that, they both use a slender, flexible tube with a camera at the end to inspect the colon. This operation is comparable to a colonoscopy. A colonoscopy, on the other hand, examines the entire colon, while a sigmoidoscopy only looks at the lower third. To determine whether there is blood in the patient's stool, doctors will advise a fecal occult blood test. In the event that blood is seen, a colonoscopy or sigmoidoscopy will probably be advised by the physician. Uncommon but serious colonoscopy complications. An intestinal rupture, significant bleeding, or an allergic response to the sedative used during the procedure are just a few of the unusual but serious side effects of a colonoscopy, according to the Canadian Cancer Society. Do unneeded colonoscopies have a negative effect? No. According to the research done by the University of Texas that was previously referenced in this video. While inappropriate colonoscopies do not damage patients, they do provide no value and are a terrible waste of time and money for hospitals. If you are having a colonoscopy, what should you tell your doctor? Asking as many questions as you can about how to get ready is the best course of action, according to the Canadian Cancer Society. You should inquire about the procedure's characteristics, expected duration, and recommended pre-operative measures. Ask your doctor what foods you should and shouldn't eat before the surgery as well. Your doctor will give you instructions on what you should do to get ready for a colonoscopy if you need one. Before the surgery, skipping breakfast and dinner is probably advised, according to the Canadian Cancer Society. Attempting to drink 2 to 4 liters of fluids that contain laxatives and electrolytes is another recommendation that they might make. Here are some suggestions on how to clean your colon now that you've learned more about colonoscopies. Detox. You can detox in addition to ingesting beneficial bacteria and probiotics through foods like yogurt, kefir, and kombucha. Detoxification is a technique for identifying the items that upset the stomach. To identify the reason for the digestive problem, food categories are gradually added back in one at a time after being severely restricted at first. For instance, if you believe that seafood is a cause of your digestive problems, cut it out of your diet for a week. If there are no problems throughout that week, you could possibly add one particular type of seafood after a couple of days. Until you can identify which seafood is causing these stomach problems, keep including different kinds of seafood. Juice cleanse. Juice cleansing is a different efficient strategy. Sea salt and fresh lemon juice are added to a glass of warm water after it has been warmed up and stirred with the sea salt. On an empty stomach, consume this mixture first thing in the morning, then have it once again right before a light meal. Afternoon is a good time to finish everything off. Prior to engaging in these cleanses or detoxes, ensure that you regularly drink enough water, eat a diet that contains a healthy balance of fats, proteins, and carbohydrates, and don't forget to acquire enough fiber. A vital organ of the human body is a colon. Not only does it break down food and expel waste, but it also makes sure that all poisons, chemicals, and harmful germs are removed from the body. Furthermore, they make sure that the body absorbs the beneficial vitamins and nutrients from diet. Numerous harmful impacts on the human body may result from a digestive system or colon that isn't operating properly. Because they won't be removed from the body, these harmful poisons will remain stagnant in the gut. Bloating, gas, diarrhea, indigestion, frequent and loose stools, fatigue, irregular bowel movements, or less than one poop per day are a few signs that your colon isn't operating as effectively and adequately as it could. More than one of these symptoms may be a sign of colon or digestive problems if you experience them. Take some of the advice from this video into account as you get ready for your colonoscopy. While most colonoscopies only take 30 to 45 minutes to complete, they can occasionally take a little longer, according to the Canadian Cancer Society. Although studies suggest that colonoscopies may not always be required, they are still the most reliable approach for doctors to check for colon cancer. The patient is watched for 1 to 2 hours after the exam. Do you have any experience with colonoscopies? What are your tips for getting through them, and what should people ask their doctors before the procedure? Let us know in the comments section below. Help us make this video the record holder for likes on our channel. Your likes not only show support, but also help YouTube recognize the video's relevance, leading to a wider distribution and an increased awareness. If you haven't subscribed to our channel yet, we invite you to do so and activate the notification bell to stay updated with our latest content. Additionally, please share this valuable knowledge video with your friends and family, spreading awareness and empowering others with important information. Together, we can make a difference and create a positive impact. You can also tweak things out. Thanks for watching.